There is something I am about to explain that could genuinely protect your life. This is not speculation. What I am sharing is a solid life or death information that every person over the age of 55 years must clearly understand. So stay with me because the answer may not be what you expect. Let us begin with the fundamentals because it is essential that you fully grasp what these two numbers actually mean, okay? Brain is especially at risk. The tiny blood vessels that supply brain tissue are not designed to withstand constant pressure. Over time, they can develop microaneurysm. These are small, weakened areas that may rupture and cause hemorrhagic stroke, or they may become narrowed or blocked, which leads to an ischemic stroke. And even without a major stroke occurring, chronically elevated systolic pressure can cause thousands of tiny so-called silent strokes, okay? Well, tiny areas of the brain tissue are gradually destroyed. Over time, this damage can result in vascular dementia, leading to memory problems, confusion, and noticeable changes in behavior and personality. Many individuals who are diagnosed with what is labeled as Alzheimer's disease are in reality suffering from vascular dementia caused by years of poorly controlled systolic pressure. Okay? The heart is also deeply affected. That muscle is forced to generate tremendous force in order to push blood into stiff, high-resistant arteries. Over time, the heart adapts by thickening its muscular walls in an attempt to meet this increased demand. This condition, known as left ventricular hypertrophy, is dangerous. A thicker heart muscle becomes less flexible. It cannot fill with blood properly and it loses pumping efficiency. This is how heart failure develops, not necessarily from a single catastrophic heart attack, but from years of heart working overtime against persistent elevated systolic pressure. The kidneys are equally vulnerable. They contain millions of microscopic filtering units, each supplied by extremely delicate blood vessels. High systolic pressure damages these vessels, gradually leading to kidney disease. Once kidney function begins to decline, the kidney loses their ability to regulate blood pressure effectively. This causes the blood pressure to rise even further, which then accelerates kidney damage. The cycle feeds on itself. This creates yet another destructive cycle, one that can ultimately lead to dialysis. Now, this is where many people become confused, and it is something I need to clarify very carefully. Does having low diastolic pressure mean you are out of danger? Absolutely not. In fact, there is a concerning situation that occurs in some older adults whose arteries have become extremely stiff. Okay? In these individuals, systolic pressure may be very high while diastolic pressure drops very low, sometimes below 60 or even under 50. This results in what is known as a wide pulse pressure, meaning there is a large gap between the top and bottom number. A wide pulse pressure is not harmless. It is a risk factor on its own and signals severe arterial stiffness, okay? Here is where it becomes especially complicated. When diastolic pressure is low, the pressure inside the arteries falls significantly during resting phase of each heartbeat, okay? Here is where it becomes especially complicated. When diastolic pressure is low, the pressure inside arteries falls significantly during resting phase of each heartbeat, okay? The coronary arteries, these are the blood vessels that supply oxygen and nutrients to the heart muscle. They receive most of their blood flow during this resting phase. If diastolic pressure drops too low, the heart muscle itself may not receive enough blood to meet its needs. This situation can result in angina, chest discomfort, and even heart attacks, sometimes occurring despite coronary arteries that appear open and unobstructed, okay? This condition is known as demand ischemia. So for older adults, the goal is not to have extremely high systolic pressure paired with a very low diastolic number. The healthiest scenario is having both values properly controlled, okay? However, if we must prioritize, if we must determine which number is most urgent to manage, the scientific evidence is unmistakable, okay? It is systolic pressure, the top number, the one that surges with every heartbeat and repeatedly batters your organs. Now, let me explain what current medical guidelines say, okay? Because this information is essential for your next visit with your doctor. In 2017, the American College of Cardiology and the American Heart Association updated their blood pressure guidelines, okay? They lowered the threshold for diagnosing hypertension to 130/80. This means that if your systolic pressure is 130 or higher, or your diastolic pressure is 80 or higher, you are now classified as having high blood pressure. They also made it clear that in older adults, controlling systolic pressure is the top priority. For most people over the age of 65 years, the general goal is to reduce systolic pressure to below 130. Some recommendations even suggest that for every healthier older adults, aiming for lower targets such as below 120 may add additional benefits, okay? This guidance comes largely from the SPRINT trial, which demonstrated significant reductions in heart attacks, strokes, and overall mortality with more intensive systolic blood pressure control, okay? That said, please note that treatment goals are not a one-size-fits-all, okay? For frail elderly individuals, particularly those over 80 years who have multiple medical conditions, slightly higher systolic targets may be safer to help avoid complications from overly aggressive blood pressure lowering, okay? Well, here is the most important takeaway you can have. If your systolic pressure is above 130, action is required. You may need to work closely with your healthcare provider to bring it down safely, okay? And if your elevated systolic pressure is being brushed aside simply because your diastolic number looks normal, that should prompt a very, very serious discussion, okay? Bring up evidence, ask directly about addressing isolated systolic hypertension. Your life could quite literally depend on this, okay? Now, let us talk about treatment. How do you actually bring that systolic number down? The answer usually requires a combination of lifestyle changes and, in many cases, medications. You need a comprehensive approach. So let me explain both. Lifestyle changes form the foundation of blood pressure control, okay? First is sodium reduction. This is one of the most powerful tools we have, particularly for lowering systolic pressure. Research shows that most people, and in many studies, Americans specifically, consume more than 3,400 milligrams of sodium each day. For individuals with hypertension, the recommended intake is no more than 1,500 to 2,000 milligrams per day. Cutting back on sodium alone can reduce systolic pressure by 5 to 10 points, which is a significant drop, okay? Eliminate highly processed foods, avoid adding salt at the table, read nutrition labels carefully and consistently. For some people, this step alone can make medications work better or even reduce the amount of medication they need, okay? Second is weight reduction if you are carrying excess weight, okay? For every kilogram, roughly 2.2 pounds that you lose, systolic pressure typically falls by about 1 point, okay? So lose 10 pounds and you may lower your systolic pressure by around 10 points, okay? Well, when you combine weight reduction with sodium restrictions, it is very, very possible to achieve systolic drop of 15 to 20 points through lifestyle changes alone, okay? Third, consistent aerobic activity. Walking, swimming, cycling, any activity that raises your heart rate to a moderate level for about 30 minutes on most days of the week, okay? Physical activity improves blood pressure in several ways, including gradually restoring some arterial flexibility, okay? And it is important to understand that this benefit goes beyond weight loss. Exercise itself acts like a medicine. Fourth, alcohol moderation. If you drink, keep it within reasonable limits. Consuming more than 2 drinks per day for men or more than 1 drink per day for women can significantly elevate blood pressure, especially systolic levels, okay? Fifth, stress reduction. Ongoing stress increases hormones like cortisol and adrenaline, both of which drive blood pressure higher. Lower stress through practices such as meditation, yoga, or deep breathing exercises. Whatever method helps calm your nervous system, make it a daily habit, okay? But here is the reality. For many people over the age of 60 years with systolic readings consistently above 140 or 150, lifestyle changes themselves are often not enough, okay? In those cases, medication is almost always required. And this is something I want to state very clearly. Taking blood pressure medication is not a personal failure. It does not mean that you didn't try hard enough. For older adults with stiff arteries and persistently high systolic pressure, medication is often life-saving, okay?